Current situation, I believe it was yesterday that we got down to in the 500s in terms of the numbers of new cases, which for Quebec is the best we've been since sometime in September of 2020. So to have the lowest number of cases in 6 months is certainly encouraging. And as you and your viewers are probably aware, now in Quebec, we've relaxed many of the zones of restrictions from the highest level, which is the red level, down to an orange level, with the notable exception of my area of the greater Montreal region, which still remains at the highest level of red, which includes things like curfew at 8 o'clock, requirement for all school children to wear masks, and so forth. So overall, it's going better than it has been in the last few months, not only in the numbers of new cases, but on all the other important metrics, the numbers of people needing hospitalization, the numbers of people requiring ICU level care. Finally, it appears that our vaccination efforts are really on the increase, which is not a coincidence, probably, that that's connected also with decreasing numbers of new cases. So there's some good reason to be optimistic. Probably the biggest storm clouds on the horizon are those posed by some of these variants, particularly the B117, the so-called UK variant, that is certainly on the increase, not only here in Quebec, but elsewhere, and certainly causing issues in some of our institutions, particularly schools.
And so you spoke a little bit about, Quebec relaxing the measures that we currently had, or other regions had. What do you think about that? Do you think it's a good moment to relax measures, or should we actually keep the red zones and be more careful, given that we are seeing a tendency of lowering case numbers?
Mm-hmm. It's an excellent question. I think it's questions on everybody's mind. It's a complicated answer to give. It depends a lot on what your philosophy is, almost, in terms of how you best want to get the entire population through this. What I mean by that is that there is one approach, the so-called COVID zero approach, the approach that was followed with overall great success in our so-called Atlantic bubble, in some other countries. I'm thinking of Australia, thinking of New Zealand as two common examples, where you do everything you can to drive the numbers of new cases down as low as possible, and only then can you subsequently relax the restrictions. And if you start, and you have to couple that with very intense monitoring and rapid action to identify and quickly isolate people who have the disease, with the whole goal being of keeping the circulating disease in the community as low as possible. And we've seen great successes with that in those areas. Yes, it takes a lot of work to drive the numbers down, takes a prolonged period of restrictions, and takes very intensive and rapid action on the part of public health authorities to keep it like that. So if you followed that philosophy, then you would say, no, this is not the time to loosen up, especially in the setting of these more contagious variants. This is where we should keep up, and if anything, double down on our efforts to really try to drive it down. We certainly can get numbers a lot lower than we have in this province. Yes, yesterday being the best day in 6 months is certainly encouraging. That said, it's not that long ago, August of last year, where Quebec had briefly under 100 cases per day. So we should be able to do better. And the fewer cases we have per day, the more we can easily focus on the prevention aspect, the public health, the monitoring, the rapid isolation, and so forth. Then there's the other side of things, which says, look, we've been through this now for a year. People are tired. This is a difficult setting on a lot of levels, economically and psychologically, and those are very valid viewpoints. And on that setting, we'd say, okay, while we can get some fresh air, let's get some fresh air. Let's loosen up. The risk is that if you loosen up too quickly when things are sort of at the beginning of improvement, then it's not, I don't think it's too controversial to say that when you loosen up on restrictions is when you make it more likely that you could have another increase in cases, particularly with these more transmissible variants. And when it comes to the effects on the population, it's all about the transmissibility. more transmissible disease, including the presence of these variants, means bigger effects on the population, means bigger demands on the healthcare system. So this is the give and take, and certainly I don't envy our politicians having to balance all of these disparate needs and trying to come up with the overall plan that is, safe and from the point of view of preventing disease, and safe from the point of view of trying to look after people's day-to-day lives and economic livelihoods and everything.
And you also touched on the variants. Of course, that's been a worry for a lot of people. Also, it's spreading in schools. Apparently, it's very present. And so, are you worried about the variants? And if so, why?
So, just like what I was alluding to, that when it comes to the burden of disease that a highly transmissible virus imposes on a population, it's really driven by the ease of transmission. So even modest increases in transmissibility because of a change in the virus, which is what we're seeing in the case of variants, or because of changes in people's behavior, even small changes that lead to increased transmissibility can lead to huge impacts in terms of the numbers of people who are affected. And at the end of the day, that's what drives the overall population burden of disease. You have more people sick at any given time, you're going to have more people needing hospital level care, access to other healthcare resources. A certain percentage of the people who require hospitalization will ultimately go on to need ICU level care. And of course, a certain proportion of people who get really sick will ultimately have long-term consequences, in some cases die from this. So this all tracks back to the transmissibility. So especially if you're worried about more transmissible virus, in particular, now that compared to even 3 months ago, SARS-CoV-2, the virus that causes COVID-19, is now a preventable disease with vaccines. So you could make a very good argument, look, we are so close here. We're finally really ramping up on getting the vaccine out to the most vulnerable populations. This is a preventable disease. Let's do everything we can to get ourselves across the finish line rather than slow up 50 yards from the end of the race.
And with the vaccine campaign going on right now, Legault actually said that he was going to accept AstraZeneca for the older population.
Depending on which group in Canada you're speaking of, you have very different advice. That is to say that the emergency use authorization issued by Health Canada upon full review of AstraZeneca's vaccine approved it for use in adults of all ages, 18 and older. There was no upper limit there. Whereas the advisory body, NACI, they said that based on their assessment at the time they issued their assessment, that there's insufficient data to establish high efficacy in adults over than 65. So already within sort of federal government, you have two different groups saying things that are not concordant. On the other hand, if you look across the world, you see exactly the same picture. The European community generally approved, and as did the WHO, again for all adults above the age of 18, and yet there are certain countries that said essentially the same thing based on the phase 3 clinical trials, in which about 90% of all the patients that were enrolled in these clinical trials that are used to establish the overall characteristics, including efficacy, about 90% of all those patients were under the age of 55. So there's a relatively small population, therefore they're not comfortable saying it's got the same high level of efficacy as we've seen with some of the other vaccines, the Pfizer and the Moderna vaccines, for example. Then again, if you look at the prior trials, not the phase 3 trials, but the phase 1 and 2 data, where there were, I guess, better representation from older adults, they seem to mount the same, more or less the same level of immune response as younger people, which it is an extrapolation to say that therefore this would the vaccine would be as efficacious, but it is another bit of proof that says that probably it should be effective. On top of that, you now have the situation of UK, where they've been giving this vaccine as their primary vaccine since December, and they seem to be seeing good response in their elderly population, both in terms of individual protection as well as reduction in disease incidence in this very vulnerable population. So you put all these pieces together, and I mean, if this was a legal case, which this is not, you'd say there's a lot of circumstantial evidence that all points in the same direction that this should be highly effective. So this is the debate that's happening here in Canada, as well as in other countries in the world. We've seen recently both France and Germany that originally said we're not going to use this for people 65 and above. Both of those countries have since reversed their decision, and now they're using it. Part of this is a pragmatics issue as well. We still have a situation of lots of people who need vaccine, very few people who have it. If you have a vaccine that you have lots of reason to believe will be highly effective, shouldn't you be using it now while we are still generating more data to know the exact characteristics of it? But there's definitely no concern in anyone's mind about the safety aspect. It's really a debate as to how effective is it in an older population, because certainly we've seen lots of other vaccines, seasonal flu vaccine, for example, where the older population tends to mount a less robust response, which of course is usually the very population you want to protect. So they want to be sure that we're not stuck into the same problem with vaccination for COVID-19.
Sorry. So do you think it's a good idea to go forward with this vaccine in the older population, or should they hold back from doing that?
In my own impression of the accumulated data, not just from the clinical trials, but as well as the accumulating real world experience so far, I think it is a reasonable approach to use it in patients who are 65 and older. I think ultimately what we're going to have with COVID-19 is going to be similar to what we've seen with other vaccine programs, that eventually we're going to find out that the best approach overall is probably using a combination of vaccines. And it may well be that the first vaccine, the first dose, would be one of these adenovirus vector vaccines like AstraZeneca's or Johnson & Johnson's. And then the second dose would be a different kind of vaccine, one of the mRNA vaccines, for example. I'm pretty sure that's the way this will head. There are some studies looking at the various mixing and matching possibilities right now. So it'll be very interesting to see some of these results as they come out.